And the contents of Bastiantra lecture are Introduction to Bastiantra, parts of Bastiantra, Bastinitra and its characteristic features, Bastinitra dosha and its effects, and currently used Bastinitra, likewise Basti Putaka, and currently used Basti Putaka modified, or currently what we are using technique, that also we are going to deal, and their features, and how to use merits and demerits, Basti Putaka dosha and its effects. All these things you are going to know today. Basti Yantra contains two parts, that is Putaka and Netra. And regarding the syllabus, you have the following points. Detailed study of the traditional Basti Yantra and their doshas, knowledge of alternative Basti Yantra, like Enema can, Enema series, modified plastic or rubber bag for Putaka, modified plastic Netra. All these things you are going to see in this presentation. Basti Yantra, it contains two parts, Basti Netra and Basti Putaka. Let us first deal with the Basti Netra, that is Enema Nozzle. What you are seeing, the bronze color, bronze metal, made of bronze metal. This is Enema Nozzle used for Niro Basti. So, for preparing Basti Netra, following materials are used. Gold, silver, copper, bronze, cow's horn, shrunga, it is horn, bones of animals, all the etc. are used. So Charaka has told these are the materials required for preparing Basti Netra. Gold, silver, they are told for the royal patients or royal healthy persons, subjects which are undergoing Panchakarma, like king, etc. The gold were used in ancient time. The shape of features of the Basti Netra, the shape should be Gopucha Samana. Gopucha Samana means it is not like that bent. Gopucha Samana means the Mula Bhaga and Agra Bhaga, if you see. Mula Bhaga should be wide, Agra Bhaga, which is you are going to insert into the Guda, should be narrow. Just like left side you are seeing the Gopucha, which is wide at its base, and at the end, at the tip, and it is narrow. So the same thing is there in Basti Netra. So Gopucha Samana means you have to consider like this. Size, Mula Bhaga, it should be Angushta Samana. Angushta means equal to the thumb. Agra Bhaga is where your Guda end, anal end, it is called anal end. And it should be Kanishtika Samana, equal to the little finger, your little finger. Then Karnikas means these are the ridges, the elevated portion of the Basti Netra. These are three in number. One is at 3 angula from the Mula Bhaga, that is where your which acts as a limiting ridge. Sorry, the first one Karnika should be, it is 3 angula from the Agra Bhaga, which limits the maximum insertion point into the Guda. The other two Karnika present at the Mula Bhaga, which is meant for tying the Basti Putaka. So the one first Karnika which is present 3 angula from the tip, which limits the entry of Netra into Guda, beyond which you cannot insert, which limits the entry of Netra into the Guda. The other two Karnika present in the near the Mula Bhaga, which is for tying the Basti Putaka. In between the two Karnika, the thread is, the Putaka is put and then thread is tied. Size, Mula Bhaga, it should be size according to the age as told by Maharshi Charaka. in Charaka Siddhi 3/8. For 1 to 6 years age, the size should be 6 angula and the diameter of tip should be Mudgavahi. Mudgavahi means the grain can pass into that. Vahi means pass. Then 7 to 12 years, the size of netra should be 8 angula and increase, 1/3 increase from 7 years to 8 year, 9 year, likewise 1/3 you have to increase till 12th year. And the diameter of the tip should be Kalaya Vahi. Kalaya means the peanut. In the sense, the mutter it is called mutter. Kannada it is called Vatane. So that should pass into that. And from 13 to 20 years, the size of the netra should be 12 angula. And the increase from 13th year should be half angula every year till 20th years. And the diameter of the tip is Kolastivahi. Kolastivahi means the Kola means badara. Jujuba fruit seed should pass into that. Runabasti netra is 8 angula and Mudgavahi Srota means the green gram can pass into the tip. This is told by Sushruta in Chikitsasthana 35/11. Size according to the age as told by Maharishi Sushruta in Sushruta Chikitsasthana 35th chapter 7 to 8 sutra. For 1 year it should be 6 angula. Diameter of Mulabhaga is Kanishtika Samana. Diameter of Mulabhaga is Kanka Pakshi Nadi Samana. Kanka is a bird. Kanka Pakshi Nadi means its beak. Diameter of Agrabhaga is Mudgavahi. Karnika 1.5 angula from Agrabhaga. For 8 year, the size should be 8 angula and diameter of Mulabhaga is Anamika Samana, index finger. And diameter of Mulabhaga Chidra is Shena Pakshinadi Samana. Diameter of Agrabhaga Chidra is Mashavahi. Means black gram can pass. Masha. Karnika 2 angula from Agrabhaga. For 16 years, the size should be 10 angula. Diameter of Mulabhaga Madhyama anguli, middle finger equal to middle finger. Diameter of Mulabhaga Mayura Pakshi Nadi Samana. And diameter of Agrabhaga Chidra is Kalayavahi. Karnika 2.5 angula from Agrabhaga. For 25 years, the size should be 12 angula. Diameter of Mulabhaga Angushta Samana, thumb. Diameter of Mulabhaga Grudra Pakshi Nadi. Chidra it is, Chidra. Should be that much. And diameter of Agrabhaga Ankurita Kalaya Vahi. Ankurita Kalaya. Kalaya Ankurita means sprouted. Sprouted. Kalaya. 3 angula from the Agrabhaga. Karnika should be present. 3 angula from Basti Netra Dosha and their vapor. Charaka says that there are 8 Basti Netra Doshas, that is Rusvam, Dirgam, Tanu, Stulam, Jirnam, Shitilavandanam, Parshvachidram, Tata Vakram, Astau, Netrani, Varjaye. Rusva Netra Desha, Netra Dosha means short, less than the size recommended. Dirgha means more than the size recommended. Tanu means very thin. Stula means very thick. Jirna means very old. Shitilavandana means loosely tied. Parshva Chidra means the Chidra should be present at Agrabhaga. If it is present on the Parshva means lateral, side of the Netra. Vakra means bended. It is bent or having deviation not straight. So what are the effects? Are the effects of doshas, complications? If it is rusva, then it won't reach. That is aprapti. Basti dravya not reaches inside the pakvashaya. Dirgha. Dirgha netra dosha causes atigati. Movement of basti dravya beyond pakvashaya. Tanu. If it is very thin, then it causes shobha, irritation. If it is stula, then it causes karshana. Karshana means it causing pressure to the anal canal. Shitila bandhana dosha causes srava, leakage of basti dravya, liquid basti kashaya, etc. You have prepared, no? The basti dravya, it is called that mixture will leak. Jirna, very old material, old netra, it causes kshanana, injury to the mucosa of anal rectum, which may causes parikartika, fissure, or bleeding from guda, etc. Parshva chidra is the hole present laterally or side of the netra. It causes guda peda, pain in anal canal and rectum. Vakra, gati jimma, causes different deviated direction, not straight, not it goes directly towards the rectum, rather than some it may stuck into the lateral wall, etc. Means mucosal folds. So there is a hindrance in the movement of basti dravya. Liquid which is coming out from the netra will not go properly above in the Prushta direction, what is told, vertebral column direction, Shastra says. And currently used Bastinitra. Currently we are using plastic Bastinitra. As metal Bastinitra, it is cost is more, and because of following advantages, we are using plastic Bastinitra. It is very economical, easy to use, easy to wash, and easy to reuse. Different sizes are available, easily we can make. Advantages, as we discussed, they are easy to handle, can be reused after proper washing in antiseptic solutions for same patient, and it should not be used for other patient. You can discard. For one patient, you can use repeatedly for 8 times, 10 times, or 20 to 30 times after washing properly. But hepatitis, HIV, etc., you cannot use it for other patients. You can discard. It is very low cost. Light in weight, easy to handle. Minimal netra dosha. Netra doshas will not be there much. Can be used for single person for whole course, and so we can prevent the infections. Chance of infections are very least. Otherwise, what happens if hepatitis B patient comes? There is a chance of spread of infection to other HIV. Likewise, SCV. All these infections are easily spread to other patients if it is not properly washed. And also there is a chance of infection to the therapist or the doctor who is administering, if he has not properly wear the gloves. And rubber catheter we are using netra for attaching to the Nirobasti pipe. These are the rubber catheter are used to attach to the nozzle of enema pot, and as well as for glycerin syringe. For Matravasti we are using enema pot, we are using for Nirobasti. It is very economical, easy to use, disposable. So there are very least chance of infection. Every day also you can discard one time, one single use. From this there is a very lesser chance of infection, and there is no netra dosha at all. But here you are seeing in exam, some examiner will ask you, the chidra is present in rubber catheter lateral, parshva chidra dosha present. Then it will cause vapor. So the rubber catheter should not be used because it is dosha yukta. Then you can say the chidra or opening present in the rubber catheter is the direction of which is anterior, not lateral. Opening direction, if you see foramina ovale in bone, the nutrient foramina, the direction it is, if you have seen in the bone, that if the opening is towards the upper end. Likewise here, the anterior end, the opening direction is anterior end. So it is not parshva chidra. You have to convince like that way to the examiner. So Uttarabasti for netra, Uttarabasti netra, that is called Pushpa netra in Shastra. It is very small, Dwadasha angula in case of males, and for females, the 10 angula it is told. So currently we are using Rubin's cannula or insufflation cannula it is called, as well as IUI, intrauterine insemination for IVF it is used. That we are using currently. That is IUI, intrauterine insemination apparatus, it is cannula. It is used for Uttarabasti netra, Garbhashayagata Uttarabasti it is used. Then coming to the Basti Putaka, the second part of Basti Yantra, which is more important for filling the Basti Dravya. The urinary bladder of animals such as buffalo, sheep, goat, cow, etc. are used for Basti Karma. And also, due to the Basti of animal, the animal bladder are used, hence the name Basti has come to this Basti Karma. So this is, you are seeing the urinary bladder of animal. You are seeing the veins here, network of veins in this bladder. So features, it should be Druda. Druda means strong, not tearable. After means when Putaka, you have to Pidana, you have to do press with hands. Between the hands, both hands you have to press. While pressing, it should not tear. Tanu means thin, it should not be thick. Nastasira, all the veins should be it should divide of veins. If veins are there, then the Basti Dravya will leaks through that vein. Vigandha, divide of odor, smell, bad odor. The meat smell, decayed meat smell, etc. It should not be there. Muscle. Kashaya Rakta, saffron red. It should be saffron red. Sumurdu, soft. Su Shuddha, well clean. Yathanurupa, according to the size of patient's age. In case of scarcity, Plavaja Gala, bird's neck and skin are used. Plavaja Gala. Ankapada. Ankapada means the birds or small animals' leg. The leg skin is used. Ghanapata, strong cloth. Very strong cloth. These should be used in case of non-availability of the animal bladders. Nowadays, plastic bags are used. Basti Putaka dosha and their vapor. Vishama Mausala Chinna Stula Jalika Vatalaha. Snigdaha Klinnasya Tan Astau Bastin Karmasu Varjayet. The urinary bladder, which is having Vishama, irregular shape, Mausala, containing muscle, Chinna, having hole, Jalika, having network of veins, Vatalaha, containing air, Snigdaha, oily, Klinnaha, moist. These should be avoided for Basti Karma. The Basti Putaka having these 8 doshas should be avoided for Basti Karma. Why it should be avoided? Then Charaka says, Gati Vaishamya, Visratva, Srava, Daurgraya, Nisravaha, Fenila, Chuta, Adaryatva, Bastehe, Sihu Basti Doshataha. If one use such dosha-yukta putaka, then it causes these 8 defects or doshas. They are, if Vishama putaka is used, it causes Gati Vaishamya, change of direction of Basti Dravya in the rectum. Mausala, if it contains mausa, then it causes Visrata, Visratva, bad odor. Chidra, if it contains hole, then Srava, leakage of Basti Dravya. Stula, thick urinary bladder. Daurgraya, it causes Daurgraya dosha, difficult to hold or handle. Jalika, network of veins. Nisrava means if network of veins are there, oozing occurs. Oozing of micro bleeding, what you call micro bleeding, then that is called oozing. Oozing means if a pot is kept, a new pot you bring and then put the water will comes out, oozes out. It becomes empty. Likewise, it same thing happens here. Vatala, it containing air, it causes froth. Fenila dosha, froth in the Basti Dravya, which again causes Vata Prakopa inside Pakvashaya. If Fenila Basti is given, then it causes Vatala Basti, it is called. Then it leads to Vata Prakopa in the Pakvashaya, causing Admana or Ayoga of Nirovasti. Snigdha, oily Putaka, it causes Chuta dosha. Chuta means slipping. Cannot able to hold properly. So it will fall down because of slippery nature. Oily. Klinna. Klinna means moist. It causes Adharyatva dosha. Cannot able to hold in the hands. So it will fall down. Currently used Basti Yantra, modified plastic or rubber bag for Putaka and modified plastic netra. Modified plastic bag, the plastic bag of 41 micron or above higher quality should be used as an alternative to the Basti Putaka, animal bladder. For 1200 ml, 800 ml and 500 ml respectively, 2 kg, 1.5 kg and 1 kg plastic bag should be used. Advantages of plastic bag: easy to tie to the netra, easy to handle, single use and disposable, hence chances of infections are very rare, saves the time for procedure, very few Futaka dosha. That is Vatala may happen, otherwise all other doshas told, Snigdha, Klinna, means all these Stula, all these doshas will not be there in this plastic bag. So this is the Basti Yantra ready to use or ready for Nirobasti. So you are seeing in the picture, the left hand side, you see the Bastinitra on my left hand side, and right hand side you are seeing the plastic bag which is tied in between the two Karnika, and anterior end you are seeing the inserting end, here from 3 angula, one Karnika is there, which limits the entry of Bastinitra into the anal verge. So it fixes to the anal verge. And Basti Putaka, you are seeing the inside the plastic bag, the Basti Dravya. So it is now ready to administer for patient. Enema pot or can, we are using nowadays, instead of classical Basti Yantra, we are using enema pot or enema can. Most of the physicians are using enema can or pot, which is having the capacity of 1200 ml for administering Niro Basti, as it is having following advantages over the classical Basti Yantra. It is very easy to use and simple to administer, easy for cleansing. Hot water you can put, or soap water you can put, or spirit you can wash with, and then soap. The rubber catheter can be used for a single person and then disposed. Using rubber catheter, one can able to give high rectal or low rectal enema. Rubber catheter is attached to the nozzle, which is attached to the pipe. The pipe is attached to the enema can. So the nozzle, white color nozzle you are seeing, to that one on-off option will be there, knob. You can off and on. After removing the air, you can connect it to the rubber catheter and also remove air from the rubber catheter also, and then it is ready to use. No chance of complications which are told in the classical Bastinitra and Putaka. Very least chance of complications, except some if the rubber catheter is good condition, then it's okay. Sometimes block will be there, the opening will not be proper. Then you have to check it properly first. After, when the liquid will pass properly, then only you have to use that rubber catheter. Otherwise, you discard the rubber catheter and take the new one. So this is very easy to administer the Niro Basti using this enema pot. And the author of Panchakarma Vijnana, that is Professor Vaidya Kasturezi, he told in one seminar, he has administered Niro Basti nearly more than, his team, under his supervision, he has seen 17 lakh Bastis administered using this enema pot, with very least complications, very less complications. So better to use this enema pot or can. But the advantage of, there is a research carried out in Jamnagar using Basti Putaka method and classical Basti Putaka method and enema can method. In that, they found that Basti Putaka is very more effective than the enema can or enema pot. Why? Because Basti Putaka, the pressure used is more, so that it will reach higher till the transverse colon. That's why the Basti Putaka is used in most cases, most practitioners at Kerala. Other parts of the country, most of the Vaidyas, they are using enema can or enema pot. They are getting results from that also. That's why they are using. But if you want more results, good results, then you can use classical Basti Putaka method. Currently, we are in one of my students, Dr. Madhuri, is also carrying out a trial on the classical Basti Putaka method. So let us see how the effects will be. This is enema can steel one, which is most of the naturotherapists use it for. They use it for coffee enema. And the right hand side, you are seeing the measured outside. The measuring is there very clearly, so you can easily see the level of Basti going inside, as well as the total quantity also you can measure easily. This is the syringe used for Anuvasana and Matravasti. Plastic syringe available in 100 ml and 200 ml capacity. The body material and piston. Piston means the posterior end you are seeing. You are drawing back, that is called piston. It is used of soft material for easy suction. These syringes are used for enema purposes, glycerin, etc. And in Ayurveda, we are using it for oil enema, that is Anvasanavasti, Matravasti. Features: no sharp edges for easy insertion. The tip should divide off sharp edges for easy insertion. And you are seeing again the plastic syringe and the steel syringe. The advantage of steel syringe is easily you can wash in boil. You can boil it for avoiding the hepatitis B, HIV, etc. infections. Repeatedly you can use this steel syringe. The another advantage of the steel syringe, sometimes it stucks while administering. There is a hindrance of the piston. Sometimes it stucks so forcefully you have to put the pressure. At that time, sometimes the force is enormous, so patient may feel discomfort. So better to use the plastic syringe. You can dispose for after 8 days. One patient, you can use the syringe and dispose. This is Basti Yantra, simple bulb attached with a pipe. It is used for washing the wounds, deep wounds having large cavities containing pus, etc. Kashaya is warm, lukewarm or warm kashaya is drawn into this bulb, and then you squeeze with hand forcefully. The material will enter into that cavity of wound. Then all the debris, slough, etc. it is washed out. Basti Yantra used for Yonigata Uttaravasti, Yoni Margagata Uttaravasti. Vaginal dose, what you call Yoni Dhavana, Yoni Prakshalna. For that purpose, this bulb, we have to draw the Kashaya, Panchavalkala Kashaya, or Triphala Kashaya, Panchavalkala Kashaya added with Tankanamasma, or Triphala Kashaya added with Tankanamasma is taken warm, lukewarm liquid is taken, and then it is inserted into the vagina and then squeezed forcefully, so that all the mucus, etc. will come out. Especially it is used in case of white discharge and candida infections, fungal infections, etc. This is Uttaravasti. We are Garbhashagat Uttaravasti. We are using IUI, as I told, Rubin's cannula or IUI, syringe attached with Rubin's cannula or IUI is used for Uttaravasti. As you are seeing in the picture, syringe, to that attached the IUI intrauterine insemination device, it is, or Rubin's cannula also we can use. And Uttaravasti in male, we are using syringe attached with the infant feeding tube. So these we have discussed today regarding the Bastinitra, what the classics are using in ancient days, and currently what we are using, and what is the advantages and disadvantages. All these things we have discussed in today's class. So thank you for viewing this presentation. Please put your feedback and subscribe to our channel. Thank you.